Friends, welcome to Easy Nurse, where nursing education made easy. So in this session, let's discuss regarding the first and the second semester, where you can find the most repeated as well as the definitely appearing questions of nursing foundation. So let's get started. Coming to the first question is accidents. So what are accidents? These are unexpected and unintentional. Nobody does or goes for accidents intentionally. It happens unexpectedly or unintentionally, and these events results in the damage, injury or harm to any person as well as the property. So it can occur in various settings, including the workplaces. So accidents can occur in the workplaces, it can occur on the roads as well as in homes as well. So in any of these places, the accidents can occur. And accidents often arise from a combination of the human error. Humans, they make certain error, and due to which there might be accidents. Due to environmental factors, due to extreme rain, sometimes there are accidents. Nowadays there is extreme rain and hence there is accidents. So that is an environmental factor. And further, due to any equipment failure, there was sudden brake failure in the car and hence there was an accident. So due to these reasons, there may be accidents. So let's see what is the first aid management that we are giving to the unconscious patient. This is one of the most important question and most repeated question that they are asking for a 5-marker. Coming to the first aid, you need to first check what is the response of the patient. Checking the responsiveness of the patient. Is the patient unconscious? Is he gently, you first move them? Make sure he is moving, or is he responding to you? You gently shake and shout out to see if the patient is responding to your shaking and shouting out loud. So you check for the responsiveness of the patient. So the second step is you call for the help. So immediately make sure you dial the emergency number and call for the help. And the third step, what we will be doing is you need to open the airway. Make sure you need to tilt the head back side and lift the chin. So tilting the head back and lifting the chin in order to make the airway open. So you are making the airway open by doing these actions. So this is also the steps of first aid. So the next step that we'll be doing is check for breathing. So is the person breathing? So look, listen and feel for the breathing for around 10 seconds. It should not exceed 10 seconds. For about 10 seconds, you need to feel and you need to look and listen for the breathing of that patient. The next step that we'll be doing is administer the CPR. When you're administering the CPR, that is cardiopulmonary resuscitation, if the patient is not breathing, then you are immediately starting to administer the CPR to the patient. So under the CPR, what we will be usually doing, we are giving the chest compressions and followed by the rescue breaths. So the process you need to follow if in case the patient is not breathing. The next step what we'll be doing is place in the recovery position. So you need to place that patient in a recovery position. If the patient is breathing, place them in the recovery position in order to maintain an open airway for them. It should ease their breathing. So the next step is monitor the vital signs. Continuously, you need to check for the vital signs of that patient, breathing, pulse, until the emergency, as we have called for help, until they arrive, you need to keep on checking the vital signs, the breathing, the pulse, etc. And the next is you need to treat severe bleeding. If in case the patient has met with the accident, he is unconscious, extreme bleeding is there, you need to make sure if the present applying the pressure. So wherever the bleeding area is present, you apply the pressure, making sure there is no excessive bleeding at that area to control the bleeding. And the final step that we'll be doing is prevent the shock. You need to keep the patient warm and comfortable. So to extreme cold and loss of blood, the patient may go to shock. And to prevent them from going to shock, you need to keep them warm and comfortable. So these are the first aid management that we are giving for the patients with unconsciousness. So if the patient is unconscious and met with an accident, you are giving the first aid. So next, let's move on to our second important question, that is the holistic healthcare. So holistic in the sense complete. So all around healthcare that we are giving. Here we can see it focuses on treating the whole person. It's not just his body, we are treating his mind, we are treating his body and the spirit, rather than just treating the symptoms of the disease or the condition. As I just told you, you're treating the whole person rather than only the symptoms or the disease. That is called as holistic healthcare. Here we can see it is emphasizing on personalized approach that is integrating the conventional and complementary therapies in order to promote the overall well-being. For example, psychological therapy to treat the mind and certain other therapies particularly to treat the soul and spirit of that person. So let's see under this holistic care, which are all the different care included. The first important one is the physical care. Here we are addressing the physical aspects of the health like nutrition. We are checking for the exercises. We are making sure we are making that patient do certain exercise in order to increase his physical health, and the medical treatments if he is deceased. So you're treating him medically to make him healthier, to optimize the bodily functions and prevent the illnesses. So that is the primary physical care that you are giving to the patient. The next type of care under the holistic care is the emotional care. So once your mindset is being changed, your mind is healthy, your body automatically will be healthy. So that's the scenario it happens. Focuses on the mental and emotional well-being through the counseling processes, through stress management techniques. Nowadays generation, stress is extremely there in every person. So stress management technique is very important to keep your mind healthy. The next stress management techniques, therapies that is promoting psychological balance and adapt the difficult situations. So there are certain difficult situations that arises in your life. You need to know how to overcome that situation, how to fight those situations. So these therapies and techniques help us to overcome and fight those situations. That is the emotional care. Coming to the third care is the social care. Here it is involving the support systems and relationships. So a person cannot live alone for the whole rest of the life. So he needs some support system, the families, other kind of friends, etc. So how you need to build up a relationship, that has been taught in the social care. That we are helping, that kind of care we are giving in the social care, contributing to the sense of belongingness, emotional support, which is crucial for the overall health and recovery of that patient. That was about the social care. And the final one, coming to the spiritual care. Here you are acknowledging and supporting the spiritual dimensions of health. So for example, every religion, they follow their own culture and their own God. If in case you're not worshipping a God, your complete body, you feel that emptiness. So that spiritual health is very important. Here, it is supporting the spiritual dimension of that health, offering the practices like meditations, prayers and reflection to promote the inner peace and sense of purpose to the life. So this is how we are increasing and promoting the spiritual care of that person. So this 4 type of important care is necessary under the holistic care. There are certain values of holistic care which is followed when we are giving the care. Here, the first one is holistic philosophies, theories, and ethics. They are following these philosophies, theories, and ethics when they are giving the holistic care. The next value is holistic education and research. It's not just that there are certain values, theories, philosophies that only they are following and giving the care. Here they are also educating the people along with the research. Upcoming new generations, there are certain researches done. Accordingly, they are giving the care. And the next value is holistic nurse self-care. So it's not just that the holistic nurse is giving care to others. She has to do her own self-care as well when she is treating the patients. And the next value is holistic process of communication. It's just that simply numbly you can't give the care. You need to communicate to the patients, their family members, and therapeutic environment should be built, and culture. Their culture also we need to respect when we are giving the care. And the final value is holistic caring. A complete care should be given to the patient rather than treating him physically itself. So this was the concept of holistic health care. Next, let's move on to our next important question, that is importance of records and reports. So let's see firstly what is meant by records. It is nothing but it's an organized, structured information. There is certain kind of organization when you are collecting certain records, and also it is containing the structured information which is required for us, which is kept for the reference of future use. It is not just that we are using it right now, further use also it is very much important, and often it is maintained in a systematic manner, and this is called as records. And let's say what is reports? It is nothing but they are also documentation that is presenting the information. It also contains informations, findings, and summarizing based on data analysis or certain investigations. For example, blood tests. That is an investigation that is giving us information regarding a person's health. So investigations typically formatted for the sake of communication or decision-making purposes. Based on those investigations, the doctors are making decisions and giving the diagnosis for the patient. So those are called as reports. These two are very much important in the medical aspect. So let's see what is the importance of these kind of records and reports. The first main important is documentation. It acts as a document for our future use, for our present use as well. Provides a detailed account of what are the activities, what are the decisions and transactions that has occurred. That information we are getting with the help of that kind of reports and records acting as a document. So the second importance is it acts as evidence. So for example, as I just told you, if a person is suffering from cancer, how do we diagnose it? With the help of the biopsy. So biopsy is a report. So with that report, it acts as an evidence that the doctor is saying that he is having a cancer. So it acts as a report. It serves as an evidence of complaints, transaction and legal obligations. Any law is interfering with the medical field, so it acts as an evidence over there as well. So the next importance is decision making. It is facilitating the information decision making based on the accurate data and the analysis. So whatever records and reports are giving the data, based on that we can make certain decisions which is based on the patient's health. So the next importance is communication. It helps or it enhances, it increases the communication within and outside the organization. If I need to communicate certain things related to the patient, so if it is recorded or reported, then it might help the upcoming nurse as well or any other doctors as well. So it acts as a way of communication. And the next importance is accountability. It is supporting the accountability by documenting responsibilities and actions. So I have performed some action, I have given the care. Since I am recording it, it acts as accountability. Yes, I have done this action. So it accounts for my work. The next importance is the analysis. So here, it is enabling the trend analysis, forecasting. So one single record or report, it can be read to many thousands of people. It acts as a forecasting. Forecasting is very much done with the help of these records and reports, and it is helping in performance evaluation. So for example, there are 10 members who are working as nurses. Since they are documenting each of their action, we can check for their performance at the end of the month and we can decide who has performed very well. So it is helping in analyzing those actions as well. So the next importance is legal compliance. It is helping to meet the regulatory and legal requirements. So any legal aspect, if it is present, it acts or it helps in the legal compliances. And the next importance is historical references. As I just told you, it acts as an evidence. So it provides a historical record for learning from the past experiences. Few nurses have come very newly. So they need certain kind of records and reports which helps them in their further education. So it is helping them for learning and past experiences they can check. And the next importance is transparency. It is promoting the transparency in the operational and outcomes. So whatever exactly the reports and records are showing, that will be seen in the patient. For example, as I just told you, if a patient is having any disease, that is exactly shown with the help of these reports. So it shows the transparency. And the final importance is planning. It is supporting the strategic planning and resource allocation based on whatever data-driven insights is present in these records and reports. So these are the different importance of these records and reports. So let's move on to our next important question, that is, what is blood pressure and which are the factors which are causing the variations in the blood pressure? So as we all know, what is blood pressure? It is referring to the force of the blood which is seen against the walls of the arteries when the blood is being pumped by our heart. So when the blood is being pumped by our heart, the force of this blood when it is flowing through the arteries, that pressure itself is called as blood pressure. And it is measured in two different numbers. Systolic pressure means the pressure during the heart is beating, and diastolic in the sense pressure when the heart beats. Between two beats, there is certain rest. So that time the blood pressure what we are taking is the diastolic blood pressure. Pressure during the heartbeat is systolic, and the pressure when the heart rests between two beats is called as diastolic blood pressure. And there are so many factors that is causing the variations in the blood pressure. So let's see each one by one. The first factor is the age factor. The blood pressure, it is usually increasing with the age due to the stiffening of the arteries. As and when the age progresses, there is stiffening of the arteries and hence there is increase in the blood pressure. Second factor is the diet. High salt intake. If a person is taking too much amount of salt, alcohol consumption or poor diet, it can increase the blood pressure. The chances of increase in blood pressure is more. And the next factor is a physical activity. There is regular exercises. It is lowering the blood pressure. If in case the person is very much inactive, then there is chances of spike or increase in the blood pressure. Coming to the next factor is the weight. So if a person is being overweight or obese, it increases the risk of high blood pressure. And the next factor is the stress. There is chronic stress in the people which can lead to temporary or sometimes there is long-term increase in the blood pressure. This is one of the most important factor nowadays we are seeing where in which there is increase in the blood pressure, that is stress. And the next factor is the genetical factor. If a person is having a family history of hypertension, it can be usually seen in the upcoming generations as well. There might be high blood pressure. Certain chances are there. Certain medications. The next factor is medications. Certain drugs, it can either raise or lower the blood pressure. It depends on which kind of drugs. Certain drugs, it can increase, and certain drugs, it can decrease the blood pressure. So the next factor is the health conditions. Conditions like diabetes mellitus, kidney diseases and sleep apnea, they are affecting the blood pressure. In few people there might be spike and few people there might be decrease in the blood pressure due to these diabetes, kidney disease or sleep apnea. Sleep disturbances are seen. So the next factor is smoking. If a person is smoking nicotine and other chemicals in cigarette, it can increase the blood pressure or it can spike the blood pressure. So the next factor is caffeine. Caffeine lovers, be very much careful. It can increase your blood pressure. So high caffeine intake, it can cause temporary spike in your blood pressure. Next is hormones. Hormonal changes such as those during the pregnancy and menopause, it can impact on blood pressure. Few women we can see there is increase of blood pressure, and few women there might be decrease in the blood pressure during the menopause and during the pregnancy as well. And coming to the final aspect or the final factor is the time of the day. It also varies your blood pressure. At which time blood pressure typically fluctuates throughout the day. Often it will be less during the night and it will be higher in the mornings. So these are the different factors which causes variations in your blood pressure. So let's move on to our next most important question, that is the types of the hospital waste, which can be asked for a 10-marker question. Be very careful when you're answering this question. What are the medical wastes? Firstly, let's see what are these kind of medical wastes. These are any waste which is generated during the medical, dental or the healthcare activities. It can be infectious, hazardous and harmful to the human health as well as to the environment. So these are called as the medical wastes. So let's see how and what kind of types of hospital wastes are seen. The first type is infectious waste, in the sense the waste which is containing with the blood, body fluids, infectious materials, for example bandages, swabs, surgical gloves, which is posing the risk of infection. So there is high infection due to these kind of wastes and they are called as infectious wastes. Coming to the second type is the pathological wastes. What is pathological waste? It includes the human tissues, the organs of humans, body parts, fluids which is being removed during the surgery time and autopsy. When they are doing that procedure, they might remove certain body parts or certain fluids and organs or human tissues are removed, where it is requiring careful disposal to prevent the contamination of the diseases. So those are called as pathological wastes. Coming to the third one is sharp waste, items like needles, scalpels, broken glasses, which can puncture or cut. There might be cuts or wounds and puncturing due to these kind of sharp materials and hence it is called as sharp waste. There is extreme risk and there is necessity for special containers in order to dispose these kind of wastes. So that is called as sharp wastes. Coming to the next one is pharmaceutical waste. Here unused, expired or contaminated medications that can be hazardous if they are not properly disposed. So you can see as they might harm the environment as well as the people as well. So those are called as pharmaceutical waste. Coming to the next one is chemical waste. It is including the discarded chemicals like disinfectants, solvents that they are using in the laboratories and lab reagents which can be very much toxic, which can be corrosive, causing harm to the skin, and they are reactive as well. And also these kind of wastes, it requires special handling. So the next type of waste is the radioactive waste, the wastes which are seen in the radioactive substances which is used in the cancer treatment, especially in the hospitals. We are using these kind of radioactive things for the treatment of cancer, imaging tests, which is usually posing the radiation risk and requires a controlled disposal. There are certain types of disposal of these kind of radiation waste which is done in a very proper manner. And the last type of waste is the general non-hazardous waste. These are not causing any harm and hence it is called as non-hazardous waste. Regular waste such as paper, packaging, food scraps that is posing no specific health risks, but it is usually seen in the hospital in large quantities and hence they are called as general non-hazardous wastes? This question is most important question, and these are the different types of waste which are produced in the hospital. So let's move on to our next important question, that is types of abnormal pulse. So what are the different types of abnormal pulse? So first let's see what is the definition of pulse. Pulse is a rhythmic expansion and contraction of an artery as blood is pumped by our heart. When the blood is being pumped by our heart, there is rhythmic expansion and contraction of our arteries, and that is called as pulse, and it is typically felt at points like wrist and neck. It is usually reflecting the heart rate, and it can also indicate how good our circulatory health is there. So to identify our circulatory health, pulse, when you're feeling, you'll get to know how good our circulatory health is. So this is the definition of pulse. So there are certain types of abnormal pulse which is seen in the patients. So let's discuss each one by one. The first one is water hammer pulse, as you can see in this picture. The second one is the water hammer pulse. As you can see, this is the water hammer pulse. What is water hammer pulse? It's a strong, quick pulse that is collapsing very rapidly, and often it is associated with any condition like aortic regurgitation. So aorta is one of the artery which is pumping blood to all the other kind of arteries and veins. But regurgitation in the sense, when the blood has been pumped, it comes back or it falls back to the ventricles, and that is called as regurgitation, which is a health condition. So in these conditions, we can see water hammer pulse. Coming to the second one is the bounding pulse. It's a pulse that is feeling strong and full. It's complete strong and full pulse which is felt when it's a bounding pulse. This is also one irregular pulse. So it is commonly seen in conditions like extreme fever if the patient is having anxiety and hypothyroidism. So you can see when the patient is having extreme or hypothyroidism, anxiety and fever, that time we can feel that bounding pulse. Coming to the next one is pulse alternance. It's a regular rhythm with altering strong and weak beats. When you're feeling the pulse, there is strong as well as weak beats when you're feeling the pulse. So often it is indicating the heart failure. So if this is the condition, then you can suggest the patient is having certain heart conditions or heart failure conditions. So the next pulse is bigeminal pulse. It's a pattern of altering normal and premature beats. So normal beats along with premature. Prior to the normal timings, there is another beat. So that is called as bigeminal pulse. Typically, it is seen in arrhythmias condition. In the sense, irregular heartbeat if they are having, in that condition, you can see this bigeminal pulse. So the next type is weak, wiry, thready pulse. It's a pulse that is very weak, difficult to palpate. When you're palpating in all the other sides of pulse, you can feel this kind of, very difficult to palpate kind of pulse. And it is indicating low blood volume. There is decreased amount of blood in that person, or if the person is in shock, you can feel this weak, wiry, thready pulse. Coming to the next one is paradoxical pulse. That is, it's a significant decrease in the pulse strength. The pulse strength is very much low in this paradoxical pulse. And during inhalation itself, you can feel there is decreased or very low pulse, wherein which you can see in conditions like cardiac tamponade or severe asthma patients, you can feel this paradoxical pulse. Coming to the next alteration in pulse is anacrotic pulse. That is, it's a pulse with slow raising, often seen in conditions like people who are having atrial compliances like aortic stenosis. So when there is narrowing of the aorta, that conditions you can see this anacrotic pulse. So the last one is the pulsus bisferiens. What is this pulsus bisferiens? As you can see in this picture, this is the pulsus bisferiens. You can see there are 2 peaks per cardiac cycle. In each cardiac cycle, there are 2 peaks. So you can see here there are two peaks which is associated in conditions like aortic regurgitation as well as when there is clubbed condition of aortic stenosis and regurgitation. In the same person, like aortic stenosis, that is narrowing of arteries, and regurgitation of the blood, if it is seen, then usually we can feel this pulsus bispheriensis. So these are the different important abnormal pulses seen in certain patients. So let's move on to our next question, that is types of wounds. Which are all the different types of wounds? Priorly, let's see what is meant by wounds. Wounds is an injury. Wounds are nothing but these are injury to our skin or the underlying tissues. If there is any cut or injury to our skin, there is damage of the tissues which is causing physical, chemical or biological factors. It can be due to any factors and it is resulting in the break of our skin's integrity. So when there is continuous skin, there is no wound. But if in case due to all these factors, there is an wound or injury or cut, then it is called as wound. So this is a simple definition of wound. So let's see which are all the different types of wound. The first one is the acute wounds. Wounds that is usually occurring suddenly, such as cuts. So when you're playing, when you're using knives or scissors, there might be accidental wounds. That is called as cuts. So cuts, abrasions or surgical incisions, which is typically healing with certain period of time frame, predictable time frame. So there is certain period of time which the doctors are saying due to which this wound can be healed. It is called as acute wound. Coming to the second one is the chronic wound. Wounds that usually do not heal in the timely manner. So you have expected certain period of time is given but still there is no healing. Then it is called as chronic wound. It has remained open for weeks or months, such as diabetic ulcers and pressure sore wounds. It doesn't heal in a timely manner. It is called as chronic wounds. Coming to the third one is the contaminated wounds. Wounds that are usually exposed to bacteria and other pathogens. So there is increase in the risk of infection like animal bites and open fractures. So these all are usually coming under the contaminated wound, wherein which bacteria, pathogens are invading to that wound. The next type is the lacerations. They are irregularly torn or cut wounds that can vary in depth and severity. So it can be very severe. This is irregular wounds, like it might be due to tearing of the skin, cut in the skin, etc. These are called as lacerations. The next type is the puncture wounds. Punctures are usually deep, narrower, and these kind of wounds are usually caused by sharp objects. So it is penetrating the skin, such as nails and needles. So as we are using needles in the hospitals, there might be puncture wounds, which is very deep and narrow. So the next type is the burns. So these are injuries which are caused to the skin and also it is caused to the underlying tissues. Why? Because of heat, chemicals or radiations. And based on how much severe it is, we are classifying it into first, second as well third degree based on the severity of the burns. Due to any heat, radiations or due to chemicals, there is burns. And the final type is the surgical wounds, wounds which are created intentionally. So for example, certain surgery is happening, the C-section. So for the delivery of the baby, the doctors are performing C-section, which is intentionally made wound. There's a cut made. So this is intentionally made and it is also closed with the help of sutures and staples. So these are the important types of wounds. So let's next see the continuation of this, that is factors which are affecting the wound healing. What are the different factors which is causing the delay in the wound healing or progress in the wound healing? First factor is age factor. So older adults, they may experience slow healing due to decrease in the cell regeneration and circulation. So good circulation is not there in the older adults and cell regeneration, rebirth of cells is very much less when compared to the normal people in the adults. So that is one factor. Coming to the next factor is nutrition. Adequate protein is necessary for wound healing, and vitamins, especially A and C, is necessary, and minerals like zinc. If it is provided in a proper amount, wound healing can be, it can be much progressive. Less amount of time is required for one small wound to heal. If these are not provided in a proper amount, then wound healing delays. The next factor is the oxygenation. There is a requirement of sufficient blood flow and oxygen. This should be delivered to that crucial for healing purpose. So when there is wound, if there is good circulation of blood and oxygen, then wound healing process, it will reduce. The time will be reduced and wound healing will be much faster. And the next is infection. The presence of bacteria, it can impede or it can decrease the healing, and it can lead to further other complications. So with the help of these kind of bacteria, the wound healing process delays. The next factor is the chronic diseases, conditions such as diabetes, vascular diseases, and autoimmune diseases. These are impacting negatively, and healing process delays due to these chronic disease factor. And the next factor is medication. Certain medications like steroids, and also you can see chemotherapy drugs. This can cause impairment in our body's ability to heal. Due to these medications, healing process delays. And the next factor is the wound care. Proper cleaning of the wound, dressing of the wound, and management of the wound, it is very much important for the healing process. If these are not performed properly, then healing process delays. And the final factor is the stress factor. So physical as well as the emotional stress, it can hinder, in the sense it can decrease the wound healing, and also you can see this process, it affects the immune response and inflammatory response of a person, wherein which there is delay in the wound healing. So far in this session, students, we have discussed all the important topics and questions. So further, if you want any kind of important topics, please stay tuned to IInd. Thank you.